hormones ziko juu ama the hormones ziko chini. So also those ones have their classical signs and symptoms. So the patient either can come anasikia baridi sana ama anasikia joto sana, ana gain weight ama ana lose weight depending on hormones ziko deranged in which direction, either up or down.
Katika makala ya Afya Yako hii leo tunaangazia ugonjwa wa goita. Ripoti kutoka kwa Wizara ya Afya zikionyesha kupungua kwa visa hivyo kutoka 16% hadi 6%. Mabadiliko haya yakichangiwa na juhudi za kitaifa katika kuimarisha programu za kuongeza madini ya iodine kwenye chumvi, unga wa mahindi na vilevile ngano. Ugonjwa wa goita ni hali ambapo tezi ya thyroid huvimba au kuongezeka ukubwa usio wa kawaida.
Goiter is a general term ya describe enlargement of a gland around the neck, inaitwa the thyroid gland. But when you see a mass in the neck chini ya Adam's apple kwa wanaume, our first thought ni thyroid gland imekuwa kubwa. So when the thyroid gland imeanza kufura and is becoming visible, you refer to it as goiter.
Aina za goiter zinaweza kugawanywa kulingana na muonekano, sababu na kazi ya tezi ya thyroid.
There are different clinical presentations of goiter. And one of them is, so we will describe them based on their presentation, because goiter is an enlargement. So we describe how that enlargement is. That is how we come up with the types of goiter. So tunaweza sema kuna moja inaitwa nodular goiter, whereby ukishika surface it's a uniform enlargement, imefura in uniformity, hakuna mlima na mabonde when you touch it. Kuna ya pili inaitwa nodular goiter, hiyo utaanza kusikia kuna mlima na mabonde. Na kuna hile inaitwa multinodular goiter. Multinodular goiter, when you feel the consistency of that swelling, you'll feel there's a bit of roughness. Of course you cannot feel the roughness on top of the skin, but you'll feel there's bumps on it, multiple bumps.
Chanzo kikuu cha ugonjwa huo kikiwa ni ukosefu wa madini ya iodine kwenye chakula.
Majorly, goiter or enlargement of the thyroid gland, number one cause is low iodine. And you are saying low iodine because iodine is an important element in the manufacture of thyroid hormones. So majorly, issues of goiter are directly related to iodine deficiency. But otherwise, other causes not as common. Issues kama pregnancy can potentiate development of a goiter and eventually a thyroid disease. Issues kama radiotherapy, shida zingine kama diabetes can also be a risk factor to development of goiter.
Dalili za goiter hutegemea aina ya goiter na kama tezi ya thyroid zinazalisha homoni nyingi, chache au kwa kiwango cha kawaida.
It depends, or not depends. It's classified in two, either symptoms because of the hormone deficiency. Because when you have an enlarged thyroid, which is referred to as goiter, then there are symptoms related to deficiency, or rather to which hormone is affected, and then there are symptoms based on that enlargement there. So kama ni hiyo vimbe kifura hivyo, inaweza affect the surrounding structures. Na hapo kwa shingo, one of the surrounding structures is the voice box, so unaweza kuwa na hoarseness of voice. The other is the respiratory system, so utasikia mgonjwa anaweza anakohoa, na kama ni mbaya sana anaweza shindwa kupumua. Ingine ni the food system, the esophagus. Pia kama ugonjwa iko inafinyilia hizo structures, then you'll find the patient pia kuna shida na kumeza. The other ones are the vessels around it. So unasikia mgonjwa wakati anainua mkono kuna kizunguzungu. Just to name a few. But now when now you have a goiter and you do a test and you find that the hormone is not affected, it can be affected as hyperthyroidism. That means the hormones ziko juu ama the hormones ziko chini. So also those ones have their classical signs and symptoms. So the patient either can come anasikia baridi sana ama anasikia joto sana, ana gain weight ama ana lose weight, depending on hormones ziko deranged in which direction, either up or down. Yeah.
Mtu anapaswa kumwona daktari mara moja ikiwa ana dalili zozote zinazohusiana na goita, kama anavyoarifu Daktari Zakias Oketo wa hospitali ya Mama Lucy Kibaki.
Anyone with an anterior neck swelling, so that means mtu yote mwenye kuna uvimbe hapa mbele ya shingo anafaa kuona daktari. Kwa sababu gani? Kwa sababu it might not be goiter, it can be other differential diagnosis. Inaweza kuwa ni the surrounding lymph nodes zimefura, inaweza kuwa ni infection imeingia hapo ikakosi hiyo, inaweza kuwa ni some cysts za ngozi, cysts za ducts. So you have to go to the doctor. The doctors inaweza kuwa hata cancer, thyroid cancer or any other form of cancer affecting the structures in the neck. So anytime uko na hiyo uvimbe unafai kuona daktari. Immediately you have noticed that the swelling in the neck. Yeah.
Watu walio katika uwezekano mkubwa wa kupata ugonjwa huo ikisemekana ni watu ambao hawali chakula chenye madini ya iodine, watu wanaougua ugonjwa wa kisukari na vile vile wanawake wenye ujauzito.
So the age there is no definitive age. We cannot rely on the age, but because you remember this is a deficiency in certain elements in the body. So number one, watu wenye maybe wakuli chumvi ama weki chumvi kwa chakula yao, then there's a possibility they can develop, because hapo ndo penye iodine mostly is easily available. Watu wa diabetes, tena narudia, watu wenye wako na mimba, those are risk factors that can potentiate them developing out a goiter.
Ili kuzuia ugonjwa huo, daktari alishauri kula vyakula vilivyo na madini ya iodine.
Chumvi. Yeah, most of the time we already there. Yeah, so unless your pregnancy is unfortunate to cause that, ama your diabetes is that serious to cause this side effect, then we are good.
Mojawapo ya mikakati serikali imechukua ili kutokomeza ugonjwa wa goita ni kuongeza iodine kwenye vyakula, huku hospitali ya Mama Lucy Kibaki ikiongeza juhudi za kutibu wagonjwa wenye ugonjwa huo.
And that is why I will insist chumvi, kwa sababu the government from 1970 they insisted on iodinating our salts, our table salts. So majority of the salts that we purchase ziko iodinated. In 2009 they increased the amount of iodine in those salts, so we are well protected. That's why the cases of goiter, they're not as high as before the 1970s. The other thing that the government has done so far that you appreciate is, or other than iodinating our salts, they have also fortified our other products, so that we also consider those who are not able to take salt as much. So wataipata kwa maybe ugali, other processed foods. So you see, with that we are actually preventing these things before they even start. Yeah, other things that I've done, creating public awareness, not as much, but they have tried, and through these such interactions we are able to reach a wider population. Tiba. It depends. Okay, basically it depends on kwanza how the patient presents, number one, and then number two, patient's desires. Psychologically, it's not a very nice thing to have a swelling in your neck. So stigma and everything else can be a factor. So surgery is indicated, not in all cases, because of the cases that you can just treat the hormones and leave that swelling there. So sometimes surgery is indicated if that thyroid is big enough to cause the symptoms that I had earlier alluded to. The coughing, the difficulty breathing, the difficulty swallowing, the fainting, the dizziness when you are raising your hands. It means that it's compressing the surrounding structures. So you can indicate surgery there. Surgery can also be because of the cosmesis. But majorly for us, when it comes to thyroid disease, is to make sure that the hormones are within normal, because the hormones are what will probably be fatal to the patient because this disease, when it comes with hormone derangements, it's fatal to the patient. So for us, our key pillars in the management of thyroid is to ensure that the thyroid hormones are within the normal levels. Then decisions will be made on whether to go to theater or not. Yeah.
Na ili kujikinga dhidi ya ugonjwa huo, daktari alikuwa na haya ya kusema.
In conclusion, I feel like we already have, because salt, just like sugar, is like a basic need in our meals. So most of us already are doing what is necessary to prevent it from occurring. But now, because you see, too much of something is poisonous. You cannot encourage them to take too much salt, because that is also a misinformation. But we encourage them to maintain that si lazima ikuwe chumvi kwa chakula. Pia maize flour yetu utapata iko na iodine. Some of our processed foods have iodine. So we are already doing what must be done. That is why the population that is affected is very low, like 5% of a general population.